The health department and John Wood have been working very closely together, going over plans for the students' return to campus, looking at classroom setup, library setup, computer lab setup, talking about flow of traffic with students through the hallways and, masking requirements and things like that to keep students safe in the classroom and on campus. John Wood is requiring students to wear masks, when they're in the hallways, classroom. The reason for that is that the virus is contained in respiratory droplets, and if you are within 6 feet of someone and they cough, sneeze, breathe heavy, or talking, then those respiratory droplets could potentially infect the person that's near them. A lot of college instruction requires students to be closer than 6 feet. Things, if they're in a lab or a group activity, the best thing to do is to keep those activities very short duration to limit exposure, but masking is imperative in those situations. Everyone that is working closely together with someone else needs to be wearing a mask. Masking is important. It prevents the spread of the respiratory droplets to those around you. It can also help prevent you from inhaling those respiratory droplets, and it will keep everyone healthy. If you're having any symptoms of illness, especially if you have a known exposure to someone that has COVID-19, you need to seek testing. If someone has tested positive for COVID-19, you're going to be asked to stay home and stay away from other individuals in case you become positive. When you have COVID-19, you're actually contagious for 48 hours before the start of symptoms, so that's why we like you to stay away from other people after you've been exposed. So after you've been exposed, the health department will talk to you and they'll ask you to stay home. They'll give you instructions for monitoring your symptoms and advice as to where to go to get tested. So if a John Wood student tested positive and had been in the classroom setting during their contagious period, we would work with the college to determine if there's any risk to other students in that classroom and to the instructor. And what we're looking at is that social distancing was that maintained? Was there any period of time where that student and any other student or instructor spent more than 15 minutes within a 6-foot space? So just because you've been in class with someone who ends up testing positive for COVID-19 does not necessarily consider you to be a close contact. You might be considered more of a casual contact where you've been in the same vicinity but not within a 6-foot space for longer than 15 minutes. So at the point where we're at right now with the pandemic, we're only quarantining close contacts, but casual contacts also need to be aware, that they've had a little bit of exposure. But a casual contact, such as in a classroom setting where social distance is maintained, is not any riskier than just being out in the general public. We have widespread COVID in our community right now. So the way it works is when someone has tested positive, all of their close contacts are quarantined and are asked to stay away from other individuals. However, the contacts of those close contacts are not quarantined and are free to go about their daily life. So the isolation period after someone has tested positive for COVID-19 is 10 days from the start of symptoms and 72 hours symptom free. So what that looks like is most people are recovering fairly quickly. So after 10 days after symptoms start, they're able to come back to school and work and socialize. However, there are a few people whose symptoms linger a little longer. Maybe fever lasts a little longer, a really bad cough lasts a little longer, and they reach day 8 or 9 and they're still feeling pretty bad. They're going to have to be 72 hours major symptom free before that isolation period ends. Now, if you've been exposed to someone that is COVID positive, it can take up to 14 days for the virus to take hold and symptoms to begin and the illness to begin. So we're asking those individuals who've been exposed to stay home and stay away from other individuals for 14 days. So when someone's been exposed to someone that is positive for COVID-19, the health department works with them and we help them figure out what their quarantine period is, and we'll provide a letter excusing you from work and school during that time. Symptoms of COVID From the time this pandemic started to now, things have changed a lot. At the beginning, it was always a fever, cough, and shortness of breath. Those were the three hallmark symptoms to watch for. Now that has expanded. There are numerous symptoms of illness associated with COVID, and they don't always include shortness of breath, a cough, or a fever. We're seeing a lot of people with fatigue, where they're just tired. We're seeing a lot of people with muscle aches, back aches. Some people do have the cough. Some people have head congestion. They mistake it for a cold or for a sinus infection, things like that. Sometimes we're even seeing gastrointestinal issues where you have vomiting or diarrhea. If you're showing any symptoms of illness, you shouldn't be going to college, to your classroom. You shouldn't be going to work. You need to stay home. And even if it's not COVID, you don't want to spread whatever illness you do have to your coworkers and your classmates. If a student tests positive, communication is key. We're going to communicate with that positive individual, and we're going to ask them to please notify the college and let the college know that they have tested positive and that they're going to need accommodations, or if they're in quarantine, if they were a contact of a positive, so that the school can help them make accommodations to continue their learning. One test positive that is a student or a faculty member, staff member of John Wood Community College, we will let the college know that has happened. We don't release that information as far as a name, but we do encourage that positive individual to self-report.